Perfect.
How was the surgery? You finished earlier?
Oh my God, it's been a busy day. I've been here since 6:30. We've done three different procedures,
Uh-huh.
and everybody's discharged. It's quiet. Now I'm just gonna have a nice conversation with you and then head home.
Wonderful. What kind of procedures did you have today?
Early in the morning
Mm-hmm.
at 6:30, we did a laser liposuction. There's a new technology called Smart Lipo Triplex.
Uh-huh.
Basically, we suck the fat, and in order to prevent the skin from sagging, we laser the skin from
Okay.
inside. So, and the technology is amazing. Three different wavelengths of laser, and it goes under the skin, and you can literally see the skin stretch back. And as time progresses over the next 3 to 4 months, it gets even better.
Wow.
So, people want to look well rested. So, if you gain and lose some weight over your lifetime, you have a little fatty deposit under your chin. Before, all you could do was cutting surgery. Now you can do a little laser liposuction, take that extra fat off, retract the skin back, and get great results. So it's good.
Wow, amazing. And I've read about you that you're against general anesthesia, so you do that procedure with local anesthesia?
Yes. So I always tell my patients, I've been doing this for over 16 years. Whenever you hear horror stories in the news about cosmetic surgery, almost always is about anesthesia because, you know, if you don't like the results, you can revise it. If you don't like a scar, you can revise the scar. If there's bleeding, you make the bleeding stop. If there's an infection, you give them antibiotics. But when people don't wake up, they don't wake up. So the riskiest part of cosmetic surgery is anesthesia. And I've actually written a book about this. The title of the book is Please Don't Die Trying to Become Beautiful. And it talks about how hundreds of people every year in the United States alone die of anesthesia related complications.
Mm-hmm.
Because again, uh, every anesthesiologist is going to tell you, even in the best, most capable hands, there is a small but real risk, 1 in 100,000, that you may have an allergic reaction to your anesthetic. The way I do my procedures is I comfort my patients. I give them a little Valium under the tongue to relax them. I give them a small shot of Demerol for pain control, and the rest is just talk anesthesia. I talk them through it. I tell them this is what you can expect, and I numb the area really well. And I always tell them when you go to the dentist, they numb your mouth and skin, and they're working on nerves and bone, and you don't feel. All you feel is pulling and tugging, but no pain. So
Exactly.
the key is I take my time. I don't do too much. I don't do 10 different procedures at once. I do two or three smaller things. That way, it's not too much on the patient, too much on the system. And I can do it under local with just mild sedation. So it's worked for me. And I think
Wow.
it's the best and safest way to do it.
Mm-hmm.
Unfortunately, I think the reason a lot of people still use general anesthesia is this is how they learned to do it. And it is easier for the surgeon when the patient is out. When the patient is out, they can be aggressive. They don't have to worry about if the person is feeling discomfort or pain. They can concentrate on what they're doing. So I think this is a better way of doing it. This is
Mm-hmm.
the best way of doing it.
Absolutely, that's amazing. I've never met anybody like you to use only local anesthesia. That's
It's
impressive.
it's becoming more and more popular.
Uh-huh.
When I started it in 1999, no one was doing it, but more and more people are realizing that you can do these procedures under local anesthesia. And as you know, I have 40 different videos on YouTube.
Yes.
If you download my app, you can watch them all, and I actually show patients how I do facelifts, eye lifts, laser, lipo while I'm talking to the person, and the person is quite comfortable.
Mm-hmm.
Well, not everyone is a candidate. You have to choose the right patient, but it can be done.
That's great. And since we are talking about all kinds of procedures, let's continue about procedures. I also noticed that you offer best solutions for people with scars coming from acne, especially with darker skin.
Yes.
And how do you do that?
So that's one of my specialties. I live in Los Angeles, and more than half of the people who live in Los Angeles have darker skin color.
Yeah.
So if you're blonde, blue-eyed, you can have any kind of laser procedure and you'll probably heal really well. But if you have darker ethnic skin, your skin is more delicate, it leaves scars more easily, not all lasers are appropriate, so you have to be extra cautious. And what I offer is I offer 30 different laser and light sources in my practice. So when I meet someone that has, let's say, acne scarring or lines, that has Asian, Hispanic, African American, ethnic background, I can offer them lasers that are more delicate. It may take more than one session to get the result that I want, but it can be done safely and conservatively and little by little. So when I started, a lot of my patients were asking me to treat their acne scarring. And especially if they had darker skin, they had been to several different dermatologists and plastic surgeons, and they've been told, there's not much to do for you. Chemical peels don't work well for acne scarring because a chemical peel just removes a layer of skin evenly everywhere. So the skin looks more refreshed, the color is better, the pores are tighter, but the scars are still there. CO2 laser is the gold standard for treatment of acne scarring. And over the past 5 or 6 years, we've had a new development called fractional CO2 laser. And then the newest development is microfractional CO2 laser. So, you know how if you have a little acne scar and you stand in a certain light, the light is shining from the above and it just looks a lot worse. So I recreate that in the operating room. I have special magnifiers. I have the light shine from the side. And then with the laser, I go one by one by one, and I treat each scar separately, and until the skin is nice and even and flush with the skin. So yes, it's one of our specialties. We offer fat grafting with stem cells for people that have really deep indented scars. We do micro needling and derma rollers. For ice pick scars, there's a type of scar called an ice pick scar where it looks like someone took an ice pick and made holes in the skin. We actually cut each hole out one by one with tiny little circular knives called a punch. So we have different grade and different diameter punches, and we actually take the holes out. It's almost like you have a donut with a hole in it, and you're actually taking the hole from inside of the donut out and sew it, and then we laser over it.
Wow.
So we help people with ice pick scars, with atrophic scars, with box scars. I do a procedure called Subsicion. With a tiny little knife, I go underneath the skin, and one reason people get scars is there are little bands that are pulling the skin down. So we go under the skin and we cut those bands so the skin puffs up. Of course, we do fillers, we do microneedling, several different types of lasers, both invasive and non-invasive. So when I see someone with acne scarring, I put a program together for them.
Okay.
I prep their skin with bleaching cream and retin-A. I get their skin ready for a couple of weeks. And then I choose the combination of treatments that would best fit his or her lifestyle, downtime, cost, etc., and gradually improve the scars. And you can significantly improve acne scars in any skin color.
That's amazing. Dr. Rahimi, you mentioned that you in a surgery room, you fix scar one by one. How long does it usually take a procedure like that?
For example, if someone has extensive scarring over the cheeks and it will take me about an hour and 15 minutes to treat the entire skin. And then recovery can be between 3 or 4 days to up to 7 or 10 days if we do multiple procedures and do a lot of aggressive stuff.
Okay, that's not too bad.
I don't believe in 5, 6, 10-hour surgeries for cosmetic reasons. Again, when you're in the operating room that long, then your risks of complications go up with blood clots in the leg and lots of different things. So no, most of my surgeries are 1 to 2 hours.
Oh, that's great. That's very interesting. Also, you have mentioned that you do facelifts and all kinds of facial procedures as well without general anesthesia, just local, and you can speak to a person.
Sure.
What kind of demographic of patients do you usually get? Younger people or older people?
Yeah. When I finished my training in 1999, um, uh, all I had to offer patients was cutting surgery. So someone came to me and they were older, 60, 70 years old. They had a lot of sagging, a lot of sun damage. All we could do was cut. Over the past 10, 15 years, new developments in lasers, in ultrasound, radio frequency have come about where I can offer my patients non-surgical modalities. So it's really interesting. I've developed this facelift called a tulip lift. It's a minimally invasive facelift that entails actually cutting skin, tightening the muscle, but I do less and less of it because, you know, I always tell patients I'd like to push surgery back into your late 60s and early 70s. Because, first of all, facelift surgery in men usually doesn't look very natural. So our skin is different. If you lose the space between your ear and your beard, it just looks a little fake. And most men don't have the downtime to stay away from work for a couple of weeks. So again, especially in men, but also in some women, cutting surgery can just look not very natural. So it's a last resort. So we do combinations of 3 or 4 different modalities to tighten up the face and push cutting into late 60s, early 70s. So actually I've coined this term that didn't exist in the English language before. It's called quadrifecta. Quadrifecta means we borrow the best of 4 different modalities and we put it together, and the sum ends up having a greater result than each of those procedures alone. So let me explain. When I look at a face, I ask myself, well, how has the passage of time aged the skin?
Yeah.
And it's different from person to person. Someone living in Southern California or Florida has a lot of sun damage. The skin loses its elasticity, everything droops. Another person may be a smoker and has a lot of lines around their mouth. Another person has gained and lost a lot of weight and have a lot of excess fatty tissue in their neck and jowls. So I tailor a program that fits them. So for example, if the cheekbones have resorbed and everything is sagging, I put fillers in the cheekbone. There is a new filler now called Voluma that lasts 2 to 3 years.
Oh, wow.
Or I put a little bit of their own fat. And then I lift the skin up with non-surgical face and neck lifts. And we have all of them here. We have Peleve from Europe. We have All Therapy from Mass General and Harvard. We have Thermage. We have the 3rd generation newest Thermage called Thermage NXT. So I'm sorry, Thermage CPT. But All Therapy is the newest and most effective non-surgical treatment of the face and neck. It was developed at Mass General, and it lifts the face and neck and eyes with the power of ultrasound. So I look at an aging face, and I put a program together. I lift it with ultrasound or radio frequency. I fill the areas that have sunken in, like nasolabial folds and marionette lines and 11s, fill them with filler. Sometimes I do a peel or laser to remove freckles, brown spots, fine lines. And then if needed, I do a little Botox or Dysport. And then you see, now you're combining different disciplines. You're doing a little bit of laser, a little bit of radio frequency, a little bit of ultrasound, a little bit of filler and Botox. And when you put it all together, the person looks rejuvenated but not done. No one put their finger on it. There's no scarring. And that also eliminates really lengthy downtime. So it can be done safely, it can be done cost effectively, it can be done without much downtime.
And all of the above is done in one visit, or how many visits they need to make?
It depends on the person.
Okay.
A lot of times you can do these things in one sitting. Because we're not using general anesthesia, because we're not we want to make it cost effective. We can do all these things in one setting. So a little Botox here and here to smoothen the lines, a little filler here to fill in the laugh lines, a laser to get the fine lines off, and a little something to lift up the neck. Everything is done in one setting. It may take me about an hour and a half to do all 4 procedures while I'm talking to the patient.
Mm-hmm.
They physically leave my office walking out by themselves.
Mm-hmm.
And then recovery is between, 2-3 days to 5 to 7 days if I do an aggressive laser resurfacing.
Okay.
I see them the next day, I see them a week later, and the results usually look great. Occasionally a little touch-up is necessary, but most of my patients are delighted with this sort of borrowing from different disciplines and doing a little bit from different modalities to get a great result. In fact, we have patients flying in from all over the United States and even outside the US to have this line of procedures done with us.
Wow, that's wonderful. And obviously you're so successful and driven. I'm interested to go back to where you have started, how you arrived to the US, and you were selling shoes on the street, and now you're a successful surgeon. So would you tell me more, please, about your story?
Sure. I think my story is a typical immigrant story. We left Iran in the 70s. I lived in Europe for over 10 years and came to the States in 1985.
Mm-hmm.
When I came to the United States to study, I barely spoke any English. In fact, the first class I took at Santa Monica College was ESL 920, and I failed it. I failed my first class in the United States. That was an English as a second language class, ESL class. 4 years later, I graduated UCLA magna cum laude. I don't think I'm particularly bright or intelligent. I'm just very driven. I love learning, and I appreciate the opportunity to improve myself. So I worked very hard, and you're right, I actually did start delivering pizzas and selling shoes in downtown LA. But I continued to UCLA, did some AIDS research, was able to meet some wonderful people that truly made a big influence in my life and pushed me towards the right direction. I was always fascinated with medicine, and was fortunate enough to do really well in school and move on. I went to George Washington after finishing UCLA, getting my bachelor's degree. I moved to Washington, D.C. I spent 4 years there, got my medical degree at George Washington University. From there, I came back to California. I went to UCSD Medical Center for a year, and I did an internship there. And then I spent 3 years in New York at Mount Sinai Medical Center, and got my dermatology residency and became a chief resident there. And then I did a fellowship in Newport Beach to learn the art and science of cosmetic surgery. And in fact, I am now the co-director of the Beverly Hills Cosmetic Surgery Fellowship Program. This is a program that's approved by the American Academy of Cosmetic Surgery. We actually have surgeons spend 1 or 2 years with myself and my associate to learn all different types of cosmetic surgery, and then they become eligible to sit and take and become diplomats of the American of Cosmetic Surgery. Oh, wow. So it's quite an honor to now teach what I learned from other doctors, and it just keeps me up to date and sharp, and it's a wonderful experience.
Wonderful. Dr. Rahimi, you just mentioned you had some people that influenced you and were your mentors. Would you mind to name if you have some specific mentors that inspired you, maybe books or real people? Sure.
Well, I trained in New York. The chairman of my department, his name is Dr. Mark Lebwohl, Lebwohl. Wonderful man that really encouraged me to learn everything that I can. I also learned cosmetic surgery from wonderful New York dermatologists like Neil Sadek and Dr. Hieronymus. and Dr. and wonderful people in New York that encouraged me to pursue cosmetic surgery and become the best dermatologist that I can. And when I came to California, I spent some time with Dr. James Fulton. Dr. Fulton developed Retin-A in the 1960s with Dr. Kligman, and he was quite a character. He was controversial because he was very aggressive, but it was an ideal environment for me to learn because I could see the whole spectrum of cosmetic surgery and very aggressive to very conservative and learn from that. So, yeah, I've been influenced by many wonderful people. Dr. Norman Shore, he's the head of oculoplastic surgery at UCLA. He's taught me a lot about the cosmetic surgery of the eye, and someone that has since unfortunately passed, Dr. Richard Aronson. He was the founder of the American Board of Cosmetic Surgery, and I spent 10 years doing surgery with him and learned a tremendous amount about surgery of the face and neck from him. So God bless his soul. So I've been blessed and I've been influenced by a lot of different people and try to, always take the best from different disciplines and add it into my specialty of cosmetic surgery and dermatology.
Wonderful. How would you like to see yourself and your practice in 5 years?
I believe the technology is going to continue to improve. Minimally invasive is going to become the standard. Cutting is going to become a thing of the past. So we're moving away from cutting surgery. Lasers are going to get better. Non-invasive modalities are going to continue to improve, tightening the face, neck, body without much downtime. So I want to continue to have a cutting-edge practice, to offer my patients the state-of-the-art treatments that are safe and effective, and continue and grow and continue to teach. A big part of my life is also my private life. I'm blessed to have a wonderful wife who looks beautiful inside and out. She got her degree in pharmacology and is a pharmacist from USC. The past few years she's been busy raising our 3 kids. I'm blessed with 3 healthy kids and spend a lot of time. The seconds that I'm not at work, I spend with them, and I just feel very blessed. I feel like this is the American dream. I came to the States and focused and worked hard and was blessed with all these things. So it's wonderful.
I was going to just ask you, how do you manage to balance your such a busy career and to have a fantastic family and 3 kids? You have time for everything?
Well, I wish that the week had more than 7 days, but I have a wonderful, understanding wife that supports me, and we made a choice that for now she will stay home and take care of the kids, and I'll concentrate on building my practice. And especially since our kids are 5, 7, and 9 years old, they're young. But I think the key is you need to just focus on the important stuff, and I prioritize, and I still get to spend a good amount of time at home with my family, but also work on a lot of different things at the same time. So it's a balancing act. Yeah. And I'm very fortunate to have very supportive people in my life, my in-laws, my wife. Trying to have a nice balance and do everything. Life is only once. There is no dress rehearsal. This is it. So I have a lot of plans. I have a lot of things I want to still achieve.
That's wonderful. And if you would like to inspire your followers, people that want to be successful just like yourself, what would be your words of wisdom?
Sometimes I have young people who come and spend time with me in my practice, who are thinking about medicine, who are thinking about cosmetic surgery, and when they find out how long it takes, 4 years of college, 4 years of medical school, then internship, fellowship, residency, you're talking about 12 to 14, 15 years. They get discouraged. But I tell them, it's the journey that's important. You have to enjoy every part of it. You can't just say, it's going to take me 15 years to get there. You have to love it. You have to enjoy the process and every minute of it. There are a lot of sacrifices. I mean, many, many times, my friends who didn't go into medicine had a lot more free time than I did and traveled. And, you do give up certain things. But I think I wouldn't do it any differently. I would do exactly everything the same way. My suggestion and my recommendation to people who are younger, I'm talking about college or high school, who are thinking about medicine, is that make sure you love it, because if you truly enjoy it, you have no other way but to become successful at it, both financially and also mentally. But if you don't like it, don't do it, because it will wear you out and you're not going to be happy with it.
Mm-hmm. Wonderful. And you just mentioned that there are so many things for you still want to accomplish. And what are some of those things?
Well, my company is called Forever Young.
Yeah.
And when I established it in 1999, my idea was that beautification from outside, but also making people look better, but also feel better and also live longer. So I work with, again, different disciplines. I work with people whose specialty is bioidentical hormone replacement. It's still a new field and we're still learning, but I think I got my bachelor's degree from UCLA in immunology. So the human body is incredible. It's 3 billion years old and it knows how to heal itself. We still don't know which buttons to push. I think 100 years from now, they're going to say, you did what? You cut cancer out? You gave people chemo? You gave them poisons? Why? Why didn't you just make them heal themselves? So I think that's the direction that we're going to go towards, is to learn how to help our own bodies heal itself. So I think stem cells is going to be a big thing in the future. We still don't know exactly how to best use them. But for example, I'm an attending at Cedars-Sinai Medical Center. And today, in 2014, if someone has a heart attack at Cedars, they inject stem cells into the heart arteries to make more arteries, to make more blood vessels. If someone goes in with blindness, today in 2014, they inject stem cells into the eye to rebuild the retina. Well, why can't we do the same thing for after a skin cancer or from sagging skin or rejuvenating the skin? The answer is we can, but we still don't know how. So I take fat, I spin it down, I take the stem cell and I re-inject it back into the skin. I take blood, I spin it down, and I take the PRP or plasma-rich protein, which has some stem cells, and I re-inject it back. But I still don't know how to tell those stem cells to do what I want them to do. But that's the future. So stem cells, immunology, those are bioidentical hormone replacements, so that even in our 70s and 80s, we can feel like we're 20. Those are the things that are coming, and we're just still learning how to control them. So it's exciting. It's great. It's great to live in 2014, because all these new things are still, we're just starting to understand them, and it's exciting to be part of that.
Absolutely. Dr. Rahimi, I think you are one of the rare and special doctors that admits that your body can heal itself, and surgery and chemo and radiation is not the way. So I'm really grateful that you speak about that openly, because so many doctors they don't want to talk about that. It's really amazing.
I'm never afraid to tell a patient I don't know. I'm never afraid to tell a patient that when you take antibiotics for a long time, for example, for acne, it can have other repercussions. You're killing good bacteria. So we try to do it safely and holistically. I mean, I use creams and ointments, and I even use pills when I have to, but I try to do with less. And I tell patients, this is a sophisticated machine. When you give it something, it's not just that one thing will happen. 20 other things may happen, and you may not know about them for months and years to come. So it's complicated.
Mm-hmm.
It's safety first.
Yeah, that's amazing and impressive. Is there anything else you would like to add for us today?
I think we touched on a lot of the things that are really important to me. We spend time with our patients. Every patient that I do surgery on gets my personal cell phone number, so they can call me after surgery with any questions or concerns. I'm available to them. And we put individualized plans for each patient, and we also make sure they leave our office with a maintenance plan so that they maintain these results. I always tell patients, start early with maintenance, a little retin-A once or twice a week, a little glycolic peel or a facial, lots of sunscreen, and then do little procedures as you go along so you don't end up needing a big procedure. So it's all about maintenance. People work now into their 70s. A lot of my patients now work with younger people, and they feel like if they look older, there is a sort of prejudice out there, there is ageism out there, and people look at them thinking they're not cutting edge just because they're older. So, a lot of my patients come and get treatments because they want to look more refreshed, but also because they want to be more competitive in their workplace, and they don't want people to judge them just because they're getting older. The other really fascinating thing is when I started 15, 16 years ago, maybe 1% of my patients were men. Now about 20% of my patients are men, because we have other options, because we can do it non-surgically, because we can do it conservatively without much downtime. So I think that trend is going to continue. More and more men are going to do cosmetic surgery. More people are open now to cosmetic surgery, and I think the pendulum has swung back. I don't know if you remember 10 years ago in Hollywood, it was all about big breasts and big lips, and now it's come down. Now it's more natural, more a normal size and color is the norm.
Absolutely.
So yeah, I think we're on the right track.
Great, thank you so much. You're such an inspiration.
Well, thank you for choosing me to be on the cover, and thank you for telling my story to people, because I think it has a lot of different facets. It's a wonderful story that shows, US is the most amazing place on earth. I'm getting emotional thinking about it because if you work hard, you can do anything you want. I remember vividly when I came here, I didn't speak English. I would sit and watch Three's Company or Too Close for Comfort and write down the words that I didn't know and look them up in a dictionary. And if you work hard and a lot of luck, you can do anything you want. So thank you for telling people about the option of doing it without anesthesia. Thank you for telling people about what's available and what can be done safely and effectively.
Absolutely. Thank you, Dr. Rahimi. Have a great night.
Thank you much.
Bye-bye.
Bye.